Chronic diseases account for the most deaths in the entire United States, and they do not discriminate in terms of race, gender, rich, or poor. The chronic disease I'll be talking about is chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease, or COPD, is an inflammatory lung disease that causes a progressive obstruction of airflow in and out of the lungs. Some conditions that contribute to COPD are emphysema and chronic bronchitis. As of 2014, it was the third leading cause of death in the United States, with more than 11 million people diagnosed, with many more who may not know they suffer from COPD. Some signs or symptoms of COPD are constant coughing of mucus of various colors such as white, yellow, green, or clear, shortness of breath, fingernails turning grayish or bluish in color, more frequent respiratory infections such as the flu, or around the later stages of COPD, massive weight loss. Some root causes of COPD are chronic bronchitis, which is the inflammation of the bronchial tubes which carry air into the lungs, which leads to mucus forming in the airways. Another one is emphysema, which is when the walls between the air sacs in the lungs are damaged, leaving larger cavities of air, which would impair airflow. The most common cause is smoking, which causes damage to the lungs, and additional to that is secondhand smoking, where 1 out of 4 people with COPD never smoked. A fourth cause could be long exposure to air pollution or chemical fumes, and the last one is a genetic disorder called alpha-1 antitrypsin deficiency, or AATD. A few mainstream medical treatments are using a bronchodilator via an inhaler, steroids used in tandem with a bronchodilator if the symptoms are more severe, getting flu and pneumonia vaccines since people with COPD have a higher risk of respiratory infections, pulmonary rehabilitation, which is a program used to improve the well-being of people with chronic breathing problems, and the last resort is surgery, which would include lung volume reduction, which is the removal of damaged tissue in the lungs, or even a lung transplant. 5 dietary recommendations for people with COPD is to get more vitamin E to help improve the lungs' functions, increase omega-3 fatty acid intake to decrease inflammation, as well as to get more antioxidants to reduce inflammation. It is also important to eat a healthy and consistent diet to maintain good weight. And lastly, to limit salt intake, as salt can worsen the shortness of breath. 5 lifestyle recommendations is to obviously stop smoking in general, and then second to that is to avoid secondhand smoke or other air pollutants. Third is to exercise and be active to maintain a healthy lifestyle. Fourth would be to practice good hygiene to decrease the risk of getting an infection. And lastly is to seek emotional support, because people with COPD usually suffer from stress, anxiety, or depression. 5 home remedies include using eucalyptus oil in a humidifier, which would help with the shortness of breath, consuming ginseng, as it has a long history of use in Chinese medicine for respiratory conditions, consuming ginger, as it helps break down mucus and reduces inflammation. Peppermint's great, as it aids COPD by promoting the relaxation of the muscles in the respiratory tract. And lastly, an enzyme called bromelain, found from pineapples, which can help reduce inflammation. Some chronic diseases can only be treated, so it is important to have the knowledge and to maintain a healthy lifestyle to avoid suffering from one. Hopefully from this video, you learned about chronic obstructive pulmonary disease and of the different symptoms, causes, medical treatments, dietary and lifestyle recommendations, and natural home remedies. Many people do not know that they suffer from COPD since it is progressive, so if you're ever diagnosed with it, hopefully it would be in the early stages.